I'm going to talk about Alzheimer's disease and how it relates to ABCs. Now, many of you know CPR and you know airway, breathing, circulation is part of CPR. But now I'm going to talk about ABCs in relationship to Alzheimer's disease. Activities, behavior, and cognitive abilities. Now, when I say the ABCs, the A would be activities of daily living. What are the activities of daily living? The person's ability to dress, to bathe themselves, to shave, to groom. Those are some of the activities of daily living. Spending time reading, doing hobbies, listening to a lecture such as this would be an activity of daily living. Performing similar tasks that you're familiar with. You go in the kitchen, you prepare breakfast, you prepare a salad. And what do you put in your salad? Maybe you normally used to put a lot of ingredients and now you just put the lettuce in a bowl and put dressing. That will be a change in your daily activities. So that's A. And now B would be behavior. Now in behavior, these are some of the changes that a person can go through when they have dementia, particularly of Alzheimer's type, which is what we're talking about mostly. They change when you say the behavior, they may become withdrawn, they may be quiet, not want to be involved in things that they used to be involved with. They may become suspicious. They may have delusions or hallucinations. Now, what is that? Delusion is when you see something that's there, but you perceive it to be something else. For example, say there was a coat rack in the corner and it had a hat on it. A person that has a delusion could look over there and say, there's a man standing in my corner. Where if it was a hallucination, a person would perceive there's a man standing in the corner, but there's nothing there that could resemble a man, just a blank wall. That will be hallucination, which could be visual or audio, and is many times associated with mental challenges such as schizophrenia or bipolar disease. But in this case, we're talking about the Alzheimer's patient. They may exhibit some things like this, and this is where we say behavior may change in that Alzheimer's patient. They may become restless, wandering, difficulty sleeping. Impairment in their social activities. They maybe used to go out and you could have a good time, maybe at church. You're sitting around, you're chatting after church, but now they don't want to be involved in crowds. They kind of shy away from them, thinking maybe somebody's talking about them, maybe somebody says something about them. They're withdrawing from those social activities. One of the warning signs, ABC. So that was the A, we've done the B, and now we're going to try the C. The C is cognitive functions. Now when you talk about cognitive function, that's how your memory works. That's how your mind is working. They may forget familiar people, familiar places, familiar things. Maybe it's a church they've gone to all their life and now they go to that church and they don't remember the name of the church. Maybe it's a store they recently shopped at. They go in the store and they're walking around and say, have I ever been in this store before? Or maybe it's a path they drive frequently to work or something like that and they get lost while they're traveling to and fro from a location. Finding it hard to do directions that may have been simple in the past. Again, we talked about this as part of your activities of behavior, activities of daily living, but it's also part of your cognitive functioning and your ability to go in the kitchen and make a cake. Has multiple ingredients, has different amounts that have to go in there. They go in there, they have all the ingredients, they don't know what to do with them. Many times a person that has dementia or of any type, or particularly of Alzheimer's type, has difficulty putting equations together, doing a calculation, doing simple math that they might have done in the past, balancing their checkbook. They might have had no problems in the past and now they can't do that anymore. Other things they forget are times of the year, the seasons, what happens in different seasons. Many times if I'm evaluating, does a person recognize what time of year it is, I might say, what month is Christmas come in? Most people can say December. I say, what month is Thanksgiving? Most people will say November. But if I think their understanding is very limited, I might say, when is the 4th of July? What month is that? And many times they can't tell me, although I've just told them when is the 4th of July. And many times they can't tell me that. So simple things where they may have known in the past, they now don't know. So these are some of the things I refer to and others refer to when we talk about the ABCs of Alzheimer's disease.